Hi, my name's Dr. Ross Hauser. Welcome to the Hauser Neck Center here in Fort Myers, Florida. I'm here actually with somebody who's local. Derrick, like you live close by, right?
I do, yes.
And then I'm going to mention a phrase that we hear often in the office here. It's like I'm going to die. Like in other words, there's patients who have a feeling like impending doom, for lack of a better term, and it normally is patients that either are so dizzy or so have so much vertigo, or they have so much like rapid heartbeat it almost feels like they're going to die. And I just wanted you to tell some of your story because it's very interesting, and why I wanted us to talk was because you actually haven't even had prolotherapy yet. You just had the diagnostics, which we'll talk about, and then you had some scans, and then we actually focused on your curve. So you've had a somewhat remarkable recovery without even having prolotherapy. You just worked on your curve.
Correct, yes.
So when did all the symptoms start?
Years ago, really. It's almost been a lifetime.
Okay.
Really, it was probably 5 years back whenever the palpitations started, and then rapid heart rate and any type of blood pressure, because I had hypertension for the last couple of years.
And you're like thin. You
work out all the time.
And you eat relatively healthy.
Yes. Right.
So maybe that's the first point of this video. If somebody has a healthy lifestyle and the doctors say you have high blood pressure or you have palpitations and you don't know the cause, maybe you should look in maybe that it's a neck problem. So what made you think like it was a neck problem? And then two is, there were times where you thought you might, like it was like the feeling like you were going to die or something, right? So
yes,
why don't you just
absolutely.
try to describe those things?
Absolutely. It was palpitations and extreme anxiety for zero reason, eating healthy, working out. And then the biggest problem was just not being able to do anything throughout the day without having feeling heart heavy in the chest.
Did you ever sense that it was a neck problem, or that was you never had any neck pain, or did you get chiropractic care or have any clicking, popping, grinding in your neck?
Clicking, popping. I had extreme neck pain, shoulder pain. I went to a chiropractor, and then they were able to send me to you because you're the only one in the area that does the DMX. And,
oh, okay.
And so I found it for you really just for that, but then looking into your videos, understanding how it could actually help me further.
Did you try some chiropractic care before you came here? Did you try
I did.
some?
Yes.
And it didn't have an effect on the...
Not as heavy as since I've been here. No.
Okay.
Not at all. The pain would recede, but not the heart problems and the anxiety, things like that.
Here, let me just go through some of the diagnostics, and then we'll talk a little bit more of your symptoms. Now, when you first got here, we did do like EKGs and different things, and we never found an arrhythmia, so it really was tachycardia. Like tachycardia is just rapid heart rate. Could you correlate it with neck movement or a certain position, or?
Yes, absolutely. Especially looking straight down. Certain time, I'd immediately have a chest problem, or if I would lay in bed, certain positions would immediately, depending on, because it's all the left side for me,
okay.
and that would cause a palpitation. So I couldn't sleep on my left side for years.
So looking down, and then you couldn't, for whatever reason, sleep on your left side.
Correct. Right.
And those would give you the
biggest palpitations or problems, but just in general, and constantly feeling dehydrated as well was another symptom.
Okay.
Yeah.
So that would be another point, is that obviously if somebody changes their neck or head position and it gives a symptom, that would be another sign that it's a neck problem.
Right.
And then because I asked you, do you pee a lot, or are you always thirsty? So why don't you describe those symptoms?
Yes, a constant feeling of just thirsty, and then dehydrated and peeing a lot, same thing. But if I didn't drink enough water, I'd have even more episodes of heart palpitations, or it would just seem my heart would be so heavy and my heart rate would skyrocket.
So then you and I had a discussion about diabetes insipidus, which is a deficiency of a hormone called the antidiuretic hormone, ADH. And then when we did the test for diabetes insipidus, your antidiuretic hormone levels were basically 0.
Right.
So that means that your body had lost kind of the ability to retain water. So that's why you had to continuously drink water, drink water, drink water. So
Right.
you always felt dehydrated, basically.
Constantly, right.
So that was one of the things that we found. Then we found that you had jugular vein compression and that your vagus nerves, so you had very, very small vagus nerves when you first came. Now, when I first assessed you, just to go over maybe some of the symptoms that you came here for, and then tell us what's been going on since, you've been under care for a couple months.
Yes, so originally starting off, symptoms really started even, I won't go too far, but when I was 5.5 years old, fell on my head, I had seizures and things like that up until my teens. And then I had all these different studies, went to all children's as well. And then that led into, my 20s and 30s where I'd have heavy heart beat and then high blood pressure and then also heart palpitations.
Did they, as a youngster, when you had these symptoms, did they think you were just kind of a crazy kid or an anxious kid? Or
They did after all the tests. They even took my tonsils out thinking that would help.
oh my God.
Yeah, so they did everything they could to see what would happen.
What made you finally decide, like, geez, I should probably come here, like come to Caring Medical? Like, you must have been getting worried, right?
I was. I went to 2 cardiologists after that as well, and they said all they could do was surgery or pacemakers and also beta blockers as well.
Why did they want to possibly do a pacemaker? Or why did they want to put a electrical device in your? Like, why? What did they diagnose you with? Or
I look at it as if your only tool is a hammer, then everything's a nail.
Okay.
And so that's all they could really offer, really. And then what significantly helped out tremendously were your videos and going over those and understanding that there was more to my vital signs than just actually my heart, which was actually my spine. And that was what was really
screwing
causing
up your vagus nerve, which was screwing up your heart.
Correct, yes.
Okay, so we saw you 2 or 3 over the course of 2 or 3 months, and then tell us what's been going on. How have you been feeling?
I've been doing great after a year of chiropractic work here and also the 2 prolotherapy sessions. Tremendously a huge turnaround. I feel completely better where I couldn't work for a year because of my symptoms, and then now I went from that to where I can fully exercise, I can work, I don't have high blood pressure, and also I don't have diabetes insipidus anymore either. And I'm releasing the hormone that absorbs electrolytes now. So it's a completely 180 turn.
Oh, awesome. So let's just talk a little bit, because you mentioned diabetes insipidus. So when you first came in, did you have like a lot of thirst, like you wanted to drink a lot of water? Were you urinating a lot? So maybe kind of describe those symptoms.
Yes, I was drinking about 1.5 gallons of water on average, not even exercising a day, and then I was just constantly urinating as well. And then we did the blood test as well, and knowing that I wasn't releasing that hormone.
Antidiuretic hormone.
Right, correct. And that was the biggest thing. But the whole time, my heart would always be heavy, and it would always be really fast. And I don't know if it was because of low blood pressure or how that would work with that. But that was the biggest symptoms that really were really messing with me, because then my body would be in adrenaline mode and fight or flight, right? Because the palpitation would release blood through my system, and then that's whenever I would get stressed or anxious, and then you can't really do anything during that time. I went from that to completely now calm, relaxed, and enjoying myself now.
So diabetes insipidus, they call it diabetes part because with diabetes, regular diabetes, with the blood sugars, your body, because your blood sugars are so high, you have to urinate a lot. So that's why the term diabetes insipidus. So diabetes insipidus is you're not getting rid of sugar, you're actually getting rid of water because your body's missing the hormone that absorbs the water. Mm-hmm. So typically the people feel like they can't get enough water, because again, think about when you drink water, you hope your body absorbs some of the water and keeps some of the water.
Right.
So your body, you just were drinking the water, so while the water's in there, your blood pressure and things might be reasonable, but then you flush it out because you don't it doesn't stay in your system. So you have to continually replenish water. Where I, or Izzy, or anybody else may just have to drink a glass of water, you know, once or twice a day, or a few times a day, where you had to do it all the time. So did you have that thirst? Like it's almost like you had an unquenchable thirst.
I did.
Like you couldn't.
I added electrolytes. I was adding everything I needed to, and magnesium and everything. I was still constantly thirsty.
And a lot of times with that, you get dizziness. You must have had probably some dizziness.
Correct. Yes.
And then none of the doctors you had seen prior to here, they never diagnosed you with diabetes insipidus?
No, none of them.
Okay.
No.
So if we watched you now, like say, you know, we just followed you around with a camera, so do you need to drink a bunch of water now?
No.
Okay, so just by correcting your neck curve and the stability, it's almost, well, your body regained the ability to regulate water correctly.
Right. Correct. Yeah.
And then you're saying for a while you couldn't even work, right?
Yes, correct. Because the heart palpitations would happen and more frequently too. So it would be not just once a day it started, then it was multiple times within an hour or two, or right back to back. So it was frightening because I didn't know if this was a heart attack or what this was. And then I had a cardiologist misdiagnose me with mitral valve prolapse, but then I've went to 3 other ones and they said I was fine, especially going through your treatment.
Okay, so like I think a lot of people who don't have like arrhythmias or periodic tachycardia, it's hard for somebody to understand just how disabling it is. But it's so fear-provoking because and you probably would agree with this, Derrick, your heart is doing something. It's almost like the heart is sick and the heart's doing something and you can't do anything about it. And then you have this impending doom. Didn't
Correct.
you have like almost like a continual impending doom?
Yeah, so I didn't know at any minute if my heart going to stop, or because it was like an electric jolt through my body every time it would do it,
Yeah.
and it would do it multiple times in a row.
Yeah.
And so I had no idea of what was happening.
And then you take magnesium or you lay down or this or that, but it's like
It would just kind of reduce it a little bit.
yeah, that's exactly right. So then, okay, so now, okay, so I when did I last see you? Like a month ago, or how long ago was it?
A month ago, yes.
Okay,
Yeah.
so in the last month, have you had any of those episodes?
No, not at all. If I were to have anything, I know exactly where it's from. It's either holding my neck in the wrong position, things like that. But other than that, and they're very, very minute compared to what it was previously. Yes.
And then, so go through all the symptoms that you had prior to coming to Caring Medical. And like, let's just say on a scale of 0 to 10, it's a 10, like when you first got her, because it was bad, like you were basically completely disabled. So why don't you go through all the symptoms and where you're at now? Like say, if you said heart arrhythmia, heart tachycardia, it was a 10, what would you put it down like now as a 1?
1, if not even, it's 0
1.
basically.
Okay, so then go through your other things. Like,
hypertension. I don't have high blood pressure anymore at all.
like, hey, do you check it at home or do you?
I do. I check it at home regularly. And,
Okay, so what is it now?
and now it's what the normal, around 120 over 80.
Okay, and then what it used to be?
It was at 140 over 90.
Okay.
So it was that hypertension.
Yeah.
For sure. And then I just recently went to another cardiologist and did a Hauser monitor for two days. Same thing. He said heart's fine, electrical works all good, no arrhythmias anymore, everything like that.
Awesome. That's gotta make you happy.
Yes, and I'm gonna get a blood work too as well to check on that. But I don't have to drink water as often anymore.
So the diabetes insipidus, we say it's a 10. Now it's
not even.
so it's 0.
0. I'm not thirsty
Anything else?
constantly.
Any other symptoms that you had? Like difficulty swallowing, any blurry vision, any other things like, or tinnitus or vertigo, anything?
Did have tinnitus as well,
Okay,
and,
so how's
and
that?
TMJ as well, which was odd, and that's also gone away. Where I used to have to wear a mouth guard because I would clench at night from the neck.
Probably your stress has gone way down because you're feeling better.
Absolutely, that as well. Yes. So basically, everything went from 10 to 1.
Okay, so that's good.
And not only that, just in general, being able to actually function like a normal human being again has been the biggest.
Yeah, so why don't we just talk about, I mean, we might as well just do it in public, like when to stop prolotherapy, right? So when to stop prolotherapy. So is it because you're ultimately the patient, and a doctor is supposed to treat your symptoms, and if the symptoms go away, because we're getting at the root cause. there comes a point where you have enough stability, like you don't need more prolotherapy. So what's your sense today?
Would either be
Like you think you need some more prolotherapy, or you think you're good?
I think maybe a couple more times. I don't see why
Okay.
not. Or we're
So you're gonna
90%.
yeah.
but-
So okay, so that's interesting. You know, some people would say like, "Geez, why would you get an
Yeah.
invasive procedure that's expensive?" But part of it is like obviously what I'll do today is look at how severe your instability was when we're starting, and you know, at any point in time, you and I could always rescan you. So if we ever wanted, like even today, like we'll see.
Okay.
But sometimes, because you know, once you've had a life-threatening illness, like you don't want it to come back. So
Yes,
you know,
that's why I wanna
you're gonna
hear
err on the side of like, no. Like, did how many treatments did I say when we first started? Do you remember?
4 to 6.
Okay, so basically, I was saying like get 3 treatments, then we'll rescan you before we do a 4. So today would be your 3rd, right?
Right.
Yeah, so that's kind of what I had thought we should do, but you've had such a dramatic recovery, so I'll just, you know, we'll probably go over your DMX again just to make sure you need a 3rd one. But
Okay.
I call a cure, I know I'm not supposed to use that word, or remission, I call resolution of the condition when a person has had 90% of their symptoms resolved. So let's agree you've had 90% of your symptoms resolved. Then I like to see that your neck vitals that we do, you know, the jugular veins are open, and then I like to see that, you know, for the most part, you know, the instability that you had, it's pretty much resolved or almost resolved. But just appreciate you sharing your story, and so glad that you're feeling so much better.
Yeah, and thank you so much, Dr. Hauser. I really appreciate it, for sure.
Yeah.
Definitely changed my life.
Awesome, Derrick.